Module 2 of the Working with Homelessness in Hospitals training programme. My name is Paul Hamlin and I'm a project manager for Pathway. And you'll also be hearing from my colleague Tony Jablonski, who's one of Pathway's experts by experience. So this module is an introduction to the Homelessness Reduction Act and the duty to refer, and it's aimed at hospital staff. So first of all, I'd like to address some common questions and assumptions around homelessness. So first of all, if you are homeless, how do you get help with housing? Can you just go to a homeless hostel? And also, whose problem is it and whose responsibility to help? There are a number of ways to get help when you're homeless, but getting urgent help in an emergency is often very difficult, whether you're on your own or even with voluntary sector support or legal advocacy. In the module after this one, we're going to look at the different services that homeless patients can be signposted to, but first I'm going to introduce the basics of the Homelessness Reduction Act. And together these two modules will start to provide an answer to the first question. The second question, can you just go to a homeless hostel, is a common assumption and common thing that's put to advocates and homeless people themselves. But I'm afraid the answer is no. There are very few direct access hostels in the country, and the very few that there are have limited capacity. So to answer the final question, the answer is that we all have a responsibility, but there's also a specific piece of legislation that requires staff working for public bodies such as hospitals to refer homeless individuals to their local authority for assistance. And that bit of legislation is the Homelessness Reduction Act. This act came into force in April 2018 and was one of the biggest changes to the rights of homeless people in England for 15 years. It began as a private member's bill sponsored by a Conservative MP, Bob Blackman, pictured here. And Mr. Blackman credits the homelessness charity Crisis with supporting the bill through their extensive groundwork. So Crisis have previously estimated that preventing people from becoming homeless could save between £3,000 and £18,000 for every person helped in the first year alone. As well as new rights for homeless applicants, the Act introduces a new duty to refer on all public bodies, including hospitals. I'm going to talk you through some of the key elements and also provide some links for further reading at the end. So when you're homeless, you can approach a local authority and request help. However, not everyone qualifies for help, and there are 5 criteria that determine who does get help. And these are whether you're vulnerable or fall into another priority need category, whether you're eligible for assistance, and whether you're homeless, and also, to a lesser extent, your local connection and whether or not you're intentionally homeless. So of these 5, the first 3 are the most important as they determine who qualifies for emergency assistance. To receive longer term help, you also have to meet the final 2, and I'll briefly talk you through those as well. So the most important of these 5 tests, especially for homeless hospital patients, is whether they meet the vulnerability criteria that determines that they are priority need. So this is the wording from the Code of Guidance. The housing authority should determine whether, if homeless, the applicant would be significantly more vulnerable than an ordinary person would be if they became homeless. I think the key point here is that nearly all homeless patients are likely to have something that makes them more vulnerable than the ordinary person, especially if they're leaving hospital after a long inpatient stay. So patients might be vulnerable due to physical health, due to learning disabilities, due to their old age or their mental health problems, but also due to non-medical reasons such as fleeing domestic abuse or violence, or if they're vulnerable due to time spent in care, prison, or the armed forces. And as well as individual vulnerability, there are other factors which can determine if an individual or a household is in priority need. So if you're homeless due to a fire or flood, if there are children that live with the applicant, if you're pregnant, if you're age 16 or 17, and also care leavers up to the age of 21 will also be deemed as priority need. It's also worth mentioning during COVID, the government has listed some additional factors that influence vulnerability assessments. So the applicant's vulnerability is strengthened where the applicant is 70 years old or above, or has at least one of the following underlying health conditions. So I'll leave this list on the screen for a moment, and I'll also provide a link to the information at the end. But please bear in mind that this list is not exhaustive, so clinical judgment will still be needed. So what relevance is this information on vulnerability for hospital staff? So here are some of the key points I'd like you to take away. So firstly, clinical staff can play a crucial role in providing supporting medical evidence of vulnerability. So you can provide someone leaving hospital with a discharge summary. It will list their medication and the condition that they were admitted for. But even better than that would be a written summary aimed at a non-medical reader, listing all their conditions. The letter should explicitly state the risks to health posed by the patient's circumstances, especially when they're sleeping rough. And you can also refer to the wording of the definition of vulnerability in the Code of Guidance that I put on screen earlier. And also remember, the housing officer who receives the letter will be a layperson, so you'll need to describe the conditions in terms that they understand. So we'll provide an example supporting letter with this training. And if you can see on this slide, you'll see the letter explicitly references the 5 tests that local authorities apply and provides evidence for each one. So we've covered vulnerability and priority need in some detail. The second of the 3 important criteria for individuals to receive emergency assistance is eligibility. Now, eligibility includes anyone who is not a person subject to immigration controls, but also some who are. So this covers habitually resident UK nationals, Commonwealth citizens with the right of abode, EEA nationals exercising their treaty rights, overseas nationals with leave to remain, people with refugee status, and certain other groups. Now, eligibility is quite a complicated area, and it's important to note that that previous list is not exhaustive. So I think the key point here is where there's any doubt, always seek advice, and don't assume that someone's not eligible. I'll also mention that during COVID, there is some additional support for EEA nationals who would otherwise be ineligible that's available through local authorities, and we'll provide a link to that at the end. So the final important criteria for emergency assistance is whether someone is homeless or not. And this might sound obvious, but actually the statutory definition covers a broader set of circumstances than you might think. So anyone that's threatened with homelessness within the next 56 days can approach their local authority and expect some kind of assistance. If you've got accommodation in the no accommodation in the UK, but you do have somewhere abroad, you might fall foul of it and be deemed not homeless. But you might have a property and have no legal right to occupy it, or it might not be reasonable to continue to occupy it, or maybe you can't secure entry to that property. In all these circumstances, you can be deemed homeless. Finally, you might have a movable structure such as a mobile home or a camper van and have nowhere to lawfully place it. So just a quick recap, if you meet the first 3 tests of the Homelessness Reduction Act, you may be able to access emergency housing assistance through a local authority. So these 3 are vulnerability or priority need, being eligible for assistance, and whether you're homeless or not. There are also 2 further criteria which determine the longer term assistance you can get. These are local connection and whether you're intentionally homeless. So local connection is usually established by 3 main routes. So if you've lived in a council area for 6 out of the last 12 months, or 3 out of the last 5 years, you've probably got a local connection there. If you don't have either of these, they'll probably look at last settled base. But you can also have a local connection to a local authority if you're currently working or self-employed in a council area, or if you've got a close family member that's lived in that area for at least 5 years, and normally there'll need to be some kind of relationship of dependency between the 2 of you. So it's really important to note 2 common misconceptions: where you're born and the area that you're rough sleeping in actually have no bearing on local connection under the Act. The local authority do have a duty to provide emergency accommodation to some homeless applicants, regardless of local connection. They can later be referred back to the local authority they do have a local connection to for longer term assistance. However, in practice, this doesn't always happen. Often people who have recently arrived in an area may approach a nearby housing authority only to be told to present back in the town that they do have a local connection to. So the final and 5th criteria for being eligible for longer term assistance from a local authority is intentionality. So if you've done or not done something that led to your homelessness and the local authority thinks this was your fault, then you might not be given longer term assistance. So with intentionality, as with the local connection, neither should have a bearing on whether you are owed emergency assistance in most circumstances. However, in some cases, it is used to gatekeep or pre-screen applicants, but hopefully this is happening much less frequently since the introduction of the changes in the Homelessness Reduction Act. So those are the 5 tests of homelessness. I think now I'd like to hand you over to my colleague Tony, who's one of Pathway's experts by experience, and he can talk you through from the perspective of someone who's been through this process.
Hello. Yes, I'll give you a perspective from someone that's been through the homeless process and not really experienced some of the help that I would expect to have received at the time. I lived in a shared house with 4 other individuals, an HMO, and the landlord, for reasons best known to himself, decided to issue each of us with eviction notices. This was principally because we discovered he was inflating the household bills. So we were fully up to date with our rent and all the bills, but actually he was committing financial fraud and taking more money from us than he should have been doing. Obviously, to cover up, he just issued us all with a letter saying, "You've got 2 months to leave, goodbye." I therefore went to visit a local housing authority in my area and experienced somewhat an unusual situation where I went to the council offices and queued up, took a ticket. They were pretty busy that day and sat for the next hour and a half waiting to see somebody. When I got to the desk to talk to one of their housing officers, they said, they introduced themselves and said, "So what's your problem with your council flat?" And I said, "Well, no, I'm not a council tenant. I'm not here because I need repairs. I'm in the private landlord sector and have just been issued an eviction notice." "Oh," they said, "that's nothing to do with us then. I don't deal with that. You need to speak to somebody that does. You better get another ticket, sit back down and go and talk to somebody else." Great. So I get another ticket. There's no chairs left because obviously the place is busy, and I spend well over an hour standing waiting to see another council housing officer. Eventually I get to speak to someone else who deals with people in the private sector, and they introduce themselves and ask what the problem is. And I explain that I've just been issued an eviction notice by my landlord. And the response that I got was not terribly positive. They just said, "So are you homeless at the moment?" And I said, "Well, no, I've been given notice to leave." "Oh," they said, "we can't help you then. Unless you're homeless, you're not considered in need, and you'll have to come back to us when you've actually been evicted." Not a very clever situation. Obviously, I took advice from different people and went to 1 or 2 other places and other charities within the city that I live. And the answer I got was very similar. If you're not actually physically homeless, there's nothing we can do. Even though you've been issued an eviction notice, you've still got somewhere to stay, so you're not classed as priority. Obviously, several months went by and I actually became homeless, was sleeping on the streets and in my car, and started doing the rounds of the people that help with homelessness once again. There was not a lot of priority given to people that were homeless at that time. This is pre the Reduction Act 2017. Very few people had the incentive to actually get interested in your problems or to really even try and help you to find somewhere to live. And I think that illustrates that you can be signposted onto lots of different organizations and everybody sort of moves the problem on to somebody else. And you can spend an awful lot of time going to different agencies. They're quite happy to give you leaflets, but there's far too many people are homeless and very little help available at that time. So I think that...
Sorry. Thanks so much, Tony. That's really valuable. So now I'd like to talk to you about the duty to refer. Now, under the Homelessness Reduction Act, hospital staff based in A&Es, outpatients, wards, all staff now have a statutory duty to refer patients they think might be homeless or threaten of becoming homeless within 56 days to their local housing authority. They must have consent from the individual, and they must ask them which local housing authority they'd like to be referred to. The local authority then required to respond by making contact with the individual, and every local authority should have an inbox with the format duty to refer at localauthorityname.gov.uk to facilitate referrals from public bodies. And I should emphasise that this duty falls on all staff in a hospital or other public body, so anyone becoming aware of a patient's homelessness can and should help. And there is more training and resources about the duty to refer on Pathway's website, and we'll include a link to the further reading at the end. So just a quick recap, there's been a lot of information in this introduction to the Homelessness Reduction Act, but here are the three key things I'd like you to take away. So of the 5 tests of homelessness, the first 3 are the most important: priority need or vulnerability, eligibility, and homelessness. The second thing is that all hospital staff have a legal duty to help by referring consenting patients to their local authority. And finally, a supporting letter from a clinician can make a huge difference in meeting the priority need criteria. Please look at the example letter that's provided with this training. So having said all that, there are several reasons why it's important to be realistic about how much help you might be able to provide without specialist help. And this is because the law is complicated and people's circumstances are often complex to unpick. And it does take time to gather all the information required. If patients are advocating for themselves, this can be challenging, even with a supporting letter. And although the Homelessness Reduction Act has improved things for applicants, due to the short supply of accommodation, sadly, some gatekeeping still occurs, as we heard from Tony's example. So some examples of difficult scenarios would be ineligible EU nationals, patients with no recourse to public funds, people whose medical or care needs are potentially too high for regular housing, and people that are only in hospital for a short stay or just visiting A&E, but are otherwise quite vulnerable. So this is where Pathway teams can help, and you heard a bit about those in module number 1. But very briefly, they provide specialist advocacy in-house, and they can also link patients in with legal advice and other specialist help. So links for further reading will be provided with this training, but I'd like to mention 2 important telephone helplines. The first is Shelter, who provide advice directly to the homeless, and also NHAS, who provide excellent advice to professionals and caseworkers working with homeless people. So I'm going to finish with 3 questions just to help you check what you've learned. You might want to pause before I give you the answer. So what are the main 3 considerations for emergency housing assistance under the Homelessness Reduction Act? Is it A, local connection, whether you're intentionally homeless, and eligibility? B, homelessness, vulnerability, or priority need and eligibility? Or C, homelessness, local connection, and vulnerability or priority need? And the answer is, of course, B, homelessness, vulnerability, priority need, and eligibility. Second question is, whose responsibility is it to fulfill the hospital's duty to refer homeless patients to their local authority? Is it A, the admitting consultant, B, the nurse in charge of the ward, C, any clinical staff, or D, all hospital staff? And the answer is, of course, D. You don't have to be clinical to refer a patient to the local authority. So the final question, which of the following may be considered homeless under the Homelessness Reduction Act? A patient who says they cannot return home because their partner has changed the locks. B, a patient who is sleeping in their car prior to admission. And C, a patient who has recently become wheelchair bound but lives on a 5th floor with no lift access. So the answer is, in fact, all of the above. So someone who's had their locks changed on them is homeless because they cannot secure entry to it, which is described in the Act. There's also a question of safety. If the partner has changed the locks, there might be more going on, so it might not be reasonable for them to return. A patient who's sleeping in their car, this should be obvious, but a car isn't a home. And it's not reasonable to continue living in a car, especially if you've just come out of hospital. And finally, a wheelchair-bound patient with no lift access to their home is going to struggle. They can't access their home, and it's not reasonable to continue to occupy it. In many cases, they may be owed emergency help by their local authority. Thank you very much. That's the end of Module 2.